Hello everyone, welcome to another beautiful day. Today we'll be looking at a very important topic. My name is NURSEAYODELE. Join me as we go through this topic in the simplest form possible. And today's topic is hypertension. Hypertension. In this video, you would understand what hypertension is, the normal value, the abnormal value, how you can prevent it, how you can treat it, and the necessary changes you need to make in your lifestyle to help you prevent hypertension. So, what is high blood pressure? High blood pressure is called a silent killer. That is the nickname for it, a silent killer. Because most people don't know. Most people don't even know when their blood pressure is high. Most people don't know what is going on. Imagine you looking beautiful outside, but inside your blood pressure, your heart vessels, your arteries are struggling. That is what hypertension is. That is what high blood pressure is. Blood pressure is simply the force of blood pushing against your artery walls. Everyone has got a artery. We've all got a artery. And blood needs to flow through it. Blood needs to go through it. But when the blood is going to the heart, it is pumping to the heart. And from there, it goes to the rest of your body. So the force at which this blood is pumping, that is what we call blood pressure. The normal blood pressure will be 120/80. When we say 120/80, what does it mean? The upper one, which is the 120, that is the systolic. That is the pressure when your heart is beating. When your heart is beating. And the lower one, which is the 80, that is the pressure when your heart is at rest. That is the pressure when your heart is at rest. Imagine when your heart is at rest and the pressure is high, you should know there is a problem. And imagine when your heart is beating and the pressure is high, you should know there is a problem already. So, when your blood pressure is 130/80 persistently or 140/90 persistently, I mean every time, that is high blood pressure, also called hypertension, also called the silent killer. So, it's just like, let me give you a scenario. When a water is running through a hose, like a pipe, if the pressure is too high, over time, the hose weakens and it can burst. The hose weakens and it can burst. That is exactly what happens to your artery when you have high blood pressure. That is what happens to your artery when you have a high blood pressure. When it keeps pumping, it keeps going, it keeps pumping hard with force, one day it's going to explode. So that is what happens when you have a high blood pressure. So, oftentimes, hypertension has no symptoms. Most people will not even know they've got high blood pressure. Some people will be going around with a blood pressure of 210/150, 240/100, and they will still be going around and will still be going to party, dancing around. These are the people who goes around dancing at the party. Dancing at the party. So, when you don't know, when you're going through all of these things, you are going around, you don't even know what your blood pressure is. All of a sudden, you can come down with a stroke. Because when your blood pressure is too high, you can come down with a stroke, you can come down with a kidney failure, you can come down with a heart attack. You can even come down with eye problem and you lose your vision. And you lose your ability to see. So that is why you need to know what your blood pressure is at every time. And if you've been diagnosed with a high blood pressure, you need to take your medications. You need to take your medications. So, who are the people that are at risk for this high blood pressure? Who are the people that are at risk for this high blood pressure? People who eat too much salt. When you eat too much salt, you are at risk for high blood pressure. When you are overweight or you are obese, when you are overweight, when you are obese, you are at risk for high blood pressure. Those who smoke and drink heavily are also at risk for high blood pressure. Also, those who do not exercise, lack of exercise can actually lead to high blood pressure. Also, stress and poor sleep. Stress and poor sleep can lead to high blood pressure. Another one is family history. If you've got a family history of hypertension, you need to pay attention to yourself because it can be passed from one generation to another. If you've got a parent with high blood pressure, you have a tendency of having high blood pressure, and that is why you need to pay attention to it immediately. So, how can you actually do a lifestyle changes to prevent this high blood pressure? Number one is cut down your salt level. Cut down. So many of us will not eat food that is not well salted. Fine, but cut down the amount of salt you eat. Like, eat fresh fruits, eat fresh food instead of salty food. Most of those processed food have got high salt in them. Another thing is eat more fruits and vegetables. Eat more fruits and vegetables. Exercise regularly. Exercise. If it's just moving from the beginning of the road of your house to the end of the road of your house, just make sure you are moving. Make sure you are moving. Another thing is maintain a healthy weight. Maintain a healthy weight. Also, limit alcohol or quit smoking. There is no benefit to these things. No benefit to them at all. So you reduce it or you stop it. You reduce it or you stop it. Another one is reduce stress and sleep well. Reduce stress and sleep well. Most times, all of these lifestyle changes might not be enough if you have been diagnosed with hypertension. That is where the medications come in. If you've been diagnosed and you've been prescribed some medications, make sure you take your medications at all times. Don't say, oh, I checked my blood pressure today. It was a bit low. It was a bit low, so I am not taking my medications today. My darling, you need to take your medications at all times, except if your doctors come to tell you that, okay, reduce this medication, don't take these medications. Hypertension doesn't have to control your life. The earlier you know your numbers and you take actions, the better for you. The earlier you know, the better for you. So, here's my challenge for you. After watching this video, go and check your blood pressure. Go and check your blood pressure today and let me know. Put your reading in the comment section and let me know what your blood pressure level is, and probably I can advise you one or two things. So, and if this video has helped you, share it and subscribe to my channel. So, if this video has helped you, subscribe to my channel and I'll see you again in another video. Bye.